Società Italiana di Antropologia Medica for this invitation to share some preliminary reflections with all of you. And second, to thank Simona Tagliani for such, it's not only nice, but kind introduction of myself. Okay, I planned to do a presentation and show you some pictures, but unfortunately, I'm not that tech savvy and with the system, and I might lose, and then I don't know how to get back and so forth. So I will not present the pictures. Anyway, my presentation, it was actually the initial title, COVID crisis in Mozambique and neoliberalism. I'm writing from Maputo, the capital city of Mozambique, a Southern Africa country by the Indian Ocean, with an estimated population of 30 million people, with a diversity of ethnicities, languages, and religions. In the present state of emergency, circumstances which restrain mobility, sociability, and proximity, social scientists face several methodological challenges. This presentation is based mainly on mass and social media, on my previous research on another pandemic, HIV/AIDS, and of course, the extensive literature on infectious diseases and epidemics. What I'm presenting here now is work in progress, and the suggestions I put forward should be envisaged as such proposals, suggestions for future development. In Mozambique, COVID-19 is yet another crisis, in the sense of another layer, to add to diseases such as malaria, which accounts for approximately 29% of all death, or HIV/AIDS. The country, has one of the highest prevalence in the world. And besides other difficulties, such as disasters, cycles of droughts and floods, some associated with climate change, as the recent cyclone, it was a year ago, but I still feel like it's recent, Idai, which devastated parts of the central region. Moreover, the northern province of Cabo Delgado in Mozambique, which was one of the epicenters of COVID-19, has been targeted by jihadist insurgency, and an estimated 150,000 people fled the area and now constitute internal refugees. I have to say that I need to check this figure and compare it to other sources. This, not to mention guerrilla actions in the center of the country as some kind of residual effect of the 16-year civil war, which officially terminated with the peace agreement in 1992. Allow me to read a quote, a direct quote from Cameroonian scholar Akil Mbembe. Open quote, "Speaking rationally about Africa is not something that has ever come naturally. It is for all the world as if the most radical critique of the most obtuse and cynical prejudices about Africa were being made against the background of an impossibility. The impossibility of getting over and done with something without running the risk of repeating it and perpetuating it on some other guise. I am well aware of this danger. It actually haunts me as I speak or write about Mozambique or Africa. As of yesterday, June 7, Mozambique had a total of 425 confirmed cases of COVID-19 and only 2 reported deaths. The last daily increase was of 15 new cases and only 3 persons were hospitalized. Up to now, there has been mostly mild cases and the virus affects mostly youth. Probably, hypothesis yet has to do with the age structure of the country. But in some places, there is an increasing number of children and elderly. 18 health workers have been infected to date. These days, one is being swamped, for lack of another word, swamped by biomedical and biological narratives and vocabulary, acronyms which apparently no longer need to be explained, such as SARS-CoV-2, PPE, PCR, to name a few. Polemics over the use of hydroxychloroquine and chloroquine as prevention treatment for the disease. A myriad of representation of the novel coronavirus, which the immune system needs to fight and defeat in a long succession of war metaphors. As Susan Sontag and Donna Haraway referred to more than 30 years ago. I'm making a small break. Are you seeing me on screen? Is it okay? Okay, thank you.
Yes, we hear you perfectly.
Okay, thank you. In face of such biologized discourses, I would like to suggest the denaturalization and hence the historicization of COVID-19 in an attempt to escape, at least partially, to those hegemonic discourses along 2 lines. One, the environment. The other one, the health political space, borrowing from medical anthropologist Didier Fassin. Maybe he doesn't see himself as a medical anthropologist, but this is how I see him. So I will address the environment very briefly, starting with the emergence of this novel coronavirus amidst the present relation between humans and other living beings. Allow me to try to, quote, unlearn in order to relearn. I would like to bring to the fore other ways of being, of thinking, and of feeling the world, other ontologies. For instance, the Andean world sense, which conceived the earth, not earth, okay, not in terms of resources to be used, extracted, but as Pachamama, which could be translated as Mother Earth. Without romanticizing the Andean world sense, I will just oppose it to the Cartesian and hence Eurocentric one, which emerged during the Enlightenment and presupposes the primacy of humans over other living beings, the control and even domination of nature by, within quotes, man, which is associated with several types of extractivism, which implies the destruction of lands and beings. Maybe as anthropologists, we could contribute to these unlearning and relearning processes by questioning the very concepts we so often resort to. For instance, nature or environment. As for the health political space, one of the dimensions refers to the ways through which power is inscribed on bodies in a differentiated manner through what Paul Farmer called fault lines, be it gender, socioeconomic status, religion, sexual preference, and different combinations of those in some intersectional combination. Inequality crosses the domain of health through those fault lines and gets embodied in differentiated risks of disease and differentiated access to healthcare. Amidst the pandemic, healthcare is being provided by a diversity of institutional arrangements throughout the globe. Public services, military, NGOs, and different kinds of assemblages of those. The COVID-19 humanitarian emergency brought Doctors Without Borders not to Syria or refugee camps all over the world, but to Spain. We also saw through the media a naval military hospital in New York Harbor and a field hospital established in a Samaritan Spurs tent in Central Park, New York again. In spite of the different configurations through which healthcare is being provided, the role performed by public health services has been highlighted in different countries and by different political leaders. The image of Boris Johnson addressing the British people on COVID-19 from a stand upon a podium with the wording, "Stay home, protect the NHS," is quite ironic, providing that it was under the Conservative Party's leadership that neoliberal policies, which promote, within other characteristics, the rolling back of the state, particularly in terms of social commitments, were introduced in Great Britain. Neoliberal policies, though far from uniform, tend to promote some kind of downsizing, particularly of the social sectors such as health and education. In Africa, in the 80s, World Bank and International Monetary Fund conditioned loan grants on the adoption of neoliberal economic reforms, commonly known as structural adjustment programs. I will refer to them as SAPs. Mozambique adopted a SAP program in 1987, which affected health policy in significant ways. Just to mention that health expenditures per capita, in US dollars, at the time of independence was $1.5. So 1975. 1982, it increased to 4.7, 70, not 7, but 70, which means it's 3 times more, but decreased to 1.40 in 87, and then to less than $1 in 88. At the micro level, SAP brought immense hardship for the majority of the population. Declining purchasing power was such that there was an increase in malnutrition, particularly in urban areas. Social differentiation and economic disparities increased, with some benefiting from the changes, while women, children, and the poor were negatively affected by these changes, with consequences for their health and nutritional status. After huge criticism, World Bank acknowledged that actually the SAPs were disastrous, and they sought to address these through PRSPs, which are some kind of to try to how can I say, to contravene, the consequences, the social consequences of the program of the SAPs. Okay. Now, as for the national health system, and it's a pity because I had photos here from 3 different types of health services. First, I would show you a provincial hospital, quite well kept, I'd say. Then, of course, a district facility. It's not a hospital, actually. And also photos of waiting rooms, of people waiting in the rooms inside these health units, and sometimes sleeping, because these are long waiting times. The national health system in Mozambique is one of the lowest ratios of medical doctors per population in the world. These ratios are usually made in relation to 1,000 people. For instance, in Italy, there are 4 MDs for 1,000 people. In Mozambique, the ratio has to be established in relation to 100,000. So there are 3 MDs for 100,000 people. But there is a dearth of health professionals in general, not only MDs, as well as insufficient infrastructure. Think that approximately half of Mozambicans still has to walk an hour or much more, I would say much more in rural areas, to the nearest health facility. I do not want to simplify an otherwise complex context and present World Bank and IMF neoliberal policies as, quote, the cause of present situation in Mozambique. NHS has been further weakened not only by SAPS, but also by the 16-year civil war, which targets health facilities in particular and health workers, as well as by the present Mozambican government policy priorities and budget allocations. And if one thinks in terms of longue durée, we can even think of the stratified and absolutely insufficient health service during colonial times, which was thought of to provide health for the colonial population. Now, since the HIV/AIDS epidemic, followed by Ebola, several scholars, mainly medical anthropologists, I have to say, have highlighted the need to focus and strengthen national health services, which are the ones to face epidemics and pandemics of this sort. However, the centrality of public health services has to be taken with some caution. I'm thinking in particular of the widely, repeatedly call throughout the globe, throughout the continents, to flatten the contagion curve in order to prevent the collapse of NHS, or not to overburden the NHS, as if health systems got a life of their own. Seem to be almost an end in itself that conceals that NHS should function more or less adequately in order to care for patients. I would also like to explore here preventive measures recommended by WHO and its contextualization in Mozambique, focusing on frequent hygienization of hands and on quarantine. Initially, Mozambique adopted these kind of recommendations, not fully taking into account the circumstances in which most people live in Mozambique. As per hygienization, the Ministry of Health, though, rightly pointed out that in absence of soap, people could use ashes. However, this is not reflected on information, education, and communication materials, which tend to depict images of people washing hands and running water and using soap. In most of Africa, and in Mozambique in particular, running water is a luxury. According to UNICEF, in Mozambique, only approximately 50% of people have access to clean water. And this figure conceals huge disparity between urban and rural areas. Even in urban areas, mostly in shanty towns, women fetch water and public fountains and wells at a distance from their homes. They carry roughly 20-liter plastic containers of water on their heads. From my previous fieldwork in Medica province, women used on average 40 liters of water daily for bathing, cooking, and drinking. Water, back then, it costed 15 meticais. I did not make the change rate. In present neoliberal context, we are witnessing an increasing commodification of water. As per the quarantine, the state of emergency decree ignored that most people rely on some kind of daily economy for their livelihoods. In a context of increasing economic marginalization and material scarcity, most of people's economic activities include informal petty business, mainly in the form of street vending of products which range from used clothes and produce to electric cables, as well as alcohol brewing and selling. They also resort to informal piecework with task wage, which can range from unloading cargoes to working on better off small, oldest agricultural plots in rural areas, of course, or doing domestic work. In urban areas, unemployed persons also fuel the informal sector with activities ranging from washing of cars to moto and BC taxis. I had a wonderful photo of this one. What is a BC taxi? So it's basically, it's a bicycle, the person that is driving it, and then there is a place so that another person can sit on the back and be transported. So this happens with motos and also with taxis. And of course, the persons are in close proximity. So initially, they were forbidden of exercising this activity because, you know, there was no social distancing, suppose. I don't like social distancing, I have to say distancing. It's physical distancing or something. You know, there was, how can I say, manifestations, people disagreed with the measure, and then, you know, now they had to allow it anyway. The diversification of economic activities emerged, according to Bryson, in the context of neoliberal reforms. SAPs were the big catalysts of the diversification of livelihoods when they increased the need of cash, for instance, to pay for school and hospital fees. Hence, the emergence of the so-called informal economy, the precariousness of labor, the commodification of water, and the present situation of NHS in Mozambique are part and parcel of World Bank and IMF policies. Those policies contribute, they are not the only ones, to the unequal embodiment of risk, putting some bodies in an increased vulnerability in face of COVID-19. However, in spite of this dire situation, there is room for creativity and innovation too. Few examples. Even before the notification of the first confirmed case of COVID-19 in Mozambique, the capital city's elite rushed to buy alcohol and masks, which soon were sold out. Handmade masks of local, within quotes, textile, capulana, became an alternative for most of the population. Its production actually, and selling in the streets became also another source of income. In absence of running water, even in some public buildings, you know, even at university, not always we have running water. Some buckets of water with a tap on the bottom were put over plastic chairs, such as the one that appears in the poster for this presentation. Another alternative is water tanks positioned on carts were also an alternative. And these water tanks, of course, with much more water than a bucket, and with some kind of a pipe, and that gets into a bucket. So people can wash their hands and the water goes into that bucket. And these tanks with these tanks on carts are covered with prevention posters by the Ministry of Health. And all this, not to mention an ingenious foot-moved water dispenser, which avoids the use of hands and hence prevents potential transmission. This one I'm going to show you at the end, even if I got cut off and cannot get in touch with you. But I think I will manage. NHS, in collaboration with university, established a call center on which people can interact about doubts, questionings on COVID-19, but they can interact in some of the Mozambican languages. I have to say this is quite innovative in Mozambique. This approach to Mozambican language, there has been a political change. This was not only, I cannot say it was not allowed, but it was not envisaged, it was not considered, and it was even, I would say, not well regarded, the use of Mozambican languages. Anyway, I suggest that Mozambique is a space of excess of adversity, but also excess of resistance, excess of creativity, and even inventiveness to counter several kinds of hardships. Thank you.
Thank you, Carla. Thank you so much. I know that maybe there were some connection problems because on the chat sometimes people said that the connection was not so good. So please, if you have lose some passage and we want to turn back on some points, feel free to make also this kind of question, because sometimes we have lost some words. In any case, thank you, Carla. Thank you for your speech. Now the discussion is open, and I ask to the participants if they have any question for Carla. You can ask me or just open your microphone and talk, or write your question on the chat and I will read it, as you prefer. I start. Let people think about and take courage to make questions. Alessandro Lupo ask if we can, Carla, Alessandro asked if you can share now some of your image that you have selected for us. I don't know if you would like to try.
Okay, I'm going to try, but at a risk. Okay, let me try.
Okay.
We can try.
Before it, at least you saw the map of Africa. Okay. Okay, are you seeing?
Perfectly.
Okay.
Here
now
the maps of Africa.
I changed the image. Can you see now? No.
Yes. Hospital Central de Nampula.
De Nampula. Okay. And you can hear me also, right?
Yeah, perfectly.
Okay. So this is in Mozambique, health units are categorized. So you have what's called central hospitals, and there are 4 central hospitals in the country. This is one of them, and it's the northern province of Nampula. And of course, it's newly painted and looks very nice. But let me show you this other one. This is in a district in central region of Mozambique, so no longer at province level. This is the kind of facility. And I hope you can see this one. This is in Chimoio, Manica province, but you can see the people waiting outside, you know, under using the shadow of the tree to wait while they are waiting, because they can wait maybe sometimes full moon for an appointment. And this other one is also inside the provincial hospital, and you can see people actually sleeping, you know, in the benches. As for water, when I was speaking of access to water in shanty towns in the cities, so this is urban areas, but this is done mainly by women. It's here you can see the woman is pumping, you know, on these containers, on these yellow containers, and there is kind of an organization here. There is like a queue, you know, of these containers, and when they say they use 2 containers per day per family, this is this kind of container they are speaking about, 20-liter containers. And if you want me, I can tell you a little bit afterwards about the story of these yellow containers. I told you about BC taxi. Okay, here you can see they were staging, you know, and this is also in a hospital. But, and actually they were calling it BC ambulance, because this is, well, I don't even know how to say it, because she's dead. She died. The woman on the back of the bicycle, you know, had HIV/AIDS. Here are the masks I was speaking about, made of this colorful cloth, capulana. And you can see where it's being sold. If you look at the wall, you know, not, I mean, this is not, I don't know how to say it. This is a certain level of precarity, you know, when he's selling this. And this is a man and a woman making these masks.
Pronto poco, mezz'ora.
Okay. As for water, I was saying this is a public building, and I have to say, in my faculty, we have one just like that at the entrance. So a plastic chair, a bucket with water, which most of the times has no water. You know, we can use with the tap and then the bucket. This is the other one. You know, this is a cart, and you can, I hope you can see there is a tank, a water tank, a black water tank on top, you know, and the pipe where people use to wash their hands, and it is with these coronavirus posters, coronavirus prevention posters. And I am so happy I can show you this. Please see that the woman there is like a, I don't know, a stick, which she uses with the foot, you know, a string, which then, you know, gets water again from these yellow containers, you know, and there is soap so that she can wash. And this way, she doesn't use her hands on taps or other so there is less risk of transmission because it's used with the feet. So thank you. Now I want to get out of here and I don't know how.
But you can leave this image, the symbol of creativity, as you said before. So don't worry if you are not able to leave. We can share the image with the participants. So Carla, I would like to stress some of your points, waiting for question. And sorry, someone maybe has the microphone open and there are so many rumors. First of all, I have a question, a curiosity concerning the way in which in Mozambique or in Lusophone country, sorry, Joele, you have your microphone open. I close it again. Sorry. I just make my question, and then if you want to talk and to make questions, please write me on the chat. Carla, I would like to know if in a Lusophone country there has been any reaction on what happened at the beginning of April in a French TV program, and the way in which in Francophone and Anglophone Africa, this speech that now I will summarize for you has been taken by the population, and the consequences were also in African people in Europe. The 2 of April, two French clinicians, has talked about the possibility to test the vaccine in Africa, because Africa is so exposed to the risk without any kind of public health protection. As you said, public health are really the services that may face a pandemic crisis. And so the two clinicians has proposed to take Africa as the country for testing the vaccine. As in the past, this was the example, we have done with prostitution population for IDS test and so on. So we take a population, but in this case, the population was the African country. This provoke a reaction in Africa, but also I know here in Italy, for example, among African migrants, and in a classical and typical Fanonian atmosphere, now many African migrants are scared to go in public services and refuse to make any test or swabs because they fear that the doctor, the clinician may inject the vaccine. They are very scared about the possibility to be testified without any authorization. I would like to know if in Mozambique or in other Lusophone country, this kind of discussion, public discussion, was made in the street, in the hospital, and if you have any kind of reaction of population about this. The second question concern what I can call in your speech the big contradiction between the aesthetic, the beautiful Capulana, and the pollution and the contamination. So the lack of hygienic protection. This is a big contradiction that may also improve the dichotomy between what you have underlined as the construction of discrimination and the creativity of population. What you can tell more about this? I stop now, and I know that Roberto Beneduce would like to ask you something. I don't know if you want to react or take some questions all together, as you prefer. Also, Francesca Cancelliere would like to ask you a question. So there are some people who would like to talk with you.
Okay. I prefer to address, I don't know if I'm going to answer, but I will try to address the issues raised here.
Okay, thank you.
Okay. One, I am aware of this very polemic statements of those two medical doctors. But as far as I know, there was no, and I am aware also of the reaction even by public figures, you know, footballers and so forth, who came across this. But as far as I know, because I only have access to mass media, there has been no reaction to it. Even more, I sent an email to the National Committee of Bioethics saying, are you following this and that, you know? And okay, how can I say this now? And yeah, I'm live, so you know, I have to be cautious. But anyway, it was kind of a bureaucratic answer, you know. Anyway, so what I have to say that I am writing on this. I was writing on, and it makes actually a degree of ambivalence, because I was writing on ethical research, you know, and the social sciences. So how should the institutionalization and all the barriers, you know, for sometimes social research that, in my view, actually, you know, doesn't need all that red tape. So I was writing on this and saying that, for instance, all these, all these institutional boards were actually arose actually out of biomedical trespasses. You know, that's not the case with social sciences and so on. So I was trying to build a case, but actually this issue, it's true, it's French clinicians, it's clinical trials, it's vaccines and so forth. It's very specific, but still made me think that these institutional boards also have their, if they are not corrupted, they have a role to play, and an important one, you know, even if it's in terms of dissemination of what should or should not be done. Now, what I have been aware in Mozambique is, and I'm making this relationship, there were through social media, particularly WhatsApp, many messages from Africans in Europe, different parts of Europe, saying, please take care because, you know, this is happening again, and the vaccines, you know, all this issue, and so don't take any injection, don't go to hospitals or take pills because you are actually being, you know, poisoned and so forth COVID. Now, I think this fear, I think this is very interesting to research in terms of social memory. It's very easy to dismiss and say, oh, this is ignorant people, have no idea what they are saying, how can this or that happen? But there is a social memory of medical research, inappropriate medical research, abusing actually patients. And not much time ago, I mean, with HIV/AIDS and pregnant women in Rwanda. So, but it's something that I'm going to work on, and all this issue of rumors as channels, of to pass information and so forth. But no, public reaction that I know about, no. I hope it builds support. Now, I have to say, Fiona, this question on the aesthetics of Capulana, can you please repeat it to me?
Yeah. No, sorry, I was wondering if my microphone was open. I wonder if you see in this a big contradiction. From one side, we have the aesthetic of Capulana and a creativity of people. On the other side, the way in which they sell them in a very pollution condition with no hygienic how can I say in English, protection and so on. And I wonder, how do you cope with this big contradiction? From one side, the creativity, the market, the possibility of people to react and face the problem, and on the other side,
I got you.
From the other side, in a way, the still discrimination atmosphere to not have a safe space to do this, and so to use the same object and place where daily life was spent, with all the problems that we know there were also before, like for the moto taxi or ambulance taxi. So this big contradiction between aesthetic, creativity, and the challenges population face with, but the reality of discrimination that are linked together. I don't know how to make better the question.
No, thank you very much. Thank you very much. I understand you now, I think. Maybe if we don't think of it in terms of contradiction, this could help us, maybe. Because I can see your point. I mean, creativity, yes, but there are still some kind of structural issues as pollution, poverty, and so forth that are there. But, they were there anyway, with or without these masks of Capulana. The point is that, one, these masks are expensive. The other commercial masks are expensive. Second, they were sold out. There is no masks, any type. I'm not speaking of, NP, this and that, with this percentage of blockage of virus and so forth. No. Any type of industrial produced masks available for the population. I'm not speaking of health services. And I actually think this is, Capulana, as you know, is a staple, right? This is what women use, every day, and even if they use like dresses or other more Western-like clothes, they still cover themselves with the capulanas and so forth. So this is what is available. And being that available, I have to say, for instance, because I opened one of those masks, there were instructions by the Minister of Health that it should have at least two layers, and in the middle there should be a third layer, if possible, of, I don't know how to say it in English, intertella. It's some kind of a filter or something. Well, so I bought one of those masks and I use those masks, and I open it, and actually they are, the ones I bought have 3 layers, even though they don't have the so-called intertella or something, you know, it's just layers of cloth. Yes, that's what I still think it's a way, you know, of trying to protect themselves. Or some people don't even have money for these handmade capulanas and just use their capulanas to cover, you know. Or, but these I have seen less, headscarves, you know, which are generally square, and so they double it. But this is men. I haven't seen a woman with that. Men, you know, using it in some kind of a triangle. But you are right that structural conditions are still there. I mean, you know, and there is a problem, of course, that people try the masks, for instance, and choose, you know, so this can also be a way of transmission. And there was, through social media, some kind of advert saying, please don't try masks. You know, first you don't know if other people has tried before, and then if you try and then another person also try. If you buy it, and that's it, you know. Okay, this is all I can build towards you, the issue.
So now I ask Roberto Beneduce if he can open his microphone to make the question, and then after Francesca Cancelliere. And then...
Hi, Carla. Thank you very much for your speech. Just two questions, short questions. The first one concerns the situation of local experts of healing. My curiosity is about the role they had during this crisis, if they produced specific interpretation of these epidemics, if they gave specific models, as we remember in case of AIDS in South Africa, Zimbabwe, Congo, and other African countries. Do you know if traditional healers, curandeiros, produced a counter knowledge or another interpretation of this infection, as in Mali, for instance, where my colleagues, my friends told me about different theory productions during these last months. And the second question is a little bit more difficult. I spoke with a psychologist from Mozambique some weeks ago, and he told me that even if the situation is not so much dangerous or threatening in Mozambique, if I understood, until now the number of confirmed cases is very, very little, 433, only 2 or 3 deaths, official deaths for COVID. He told me, of course, for the obvious, his name, but he told me that the situation of confinement was an opportunity for police forces to make more harsh the repression in some area of the country. Have you any information about this? Thank you very much. And of course, if you prefer speaking only about the first question, for reasons of time, I.
Okay, thank you, Roberto. Okay. No, as for the first one, I don't have information on curandeiros and interpretations of COVID-19. And we are in state of emergency, cannot do field research or anything like that. But I have heard, you know, not exactly from curandeiros, but people saying, for instance, don't worry, because this is not a disease of ours. You know, and I was, what is a disease of ours then? So they would say, this is not an African disease. This has nothing to do with us. You know, this has to do with white people in Europe and so forth. This is one. And, you know, it would be interesting to go through this reasoning. And I also, more or less in the same line, because of the use of masks, people have been not very keen to use masks, okay? And the reasons they present is this one. This is not a disease of ours. And they say also, which kind of disease? This is not a disease. Which kind of disease is this one that people don't take meds, you know? So they were thinking, for instance, of HIV/AIDS, on which, you know, you have to take antiretrovirals and so forth. And people don't go to hospitals and they have to stay at home, and they are treated at home, you know, if they are sick. You know, speaking of the most, because in Mozambique, most of the cases are not hospitalized. You know, they are still under control, but they are not hospitalized. So this maybe, you know, builds towards what you are mentioning, but no, I don't have information on curandeiros, on healers, you know, themselves and their interpretation of this disease. As for the, okay, the situation of COVID-19 in Mozambique is now 430 something, and death still only 2 reported death. 18 cases of health workers and so forth. But for instance, hospitalized persons up to yesterday, you know, there were 3 hospitalizations, and all the other cases are mild cases and people remain at home. And also young people, affecting mainly young people. Now, I very much like the question you raised, your second issue, because yes, this the instrumentalization of COVID-19 for different purposes. You know, for instance, for how can I say this? Now I'm missing the words, but okay, look, these informal markets that were established within what is called the cement city, right? So Mercado de Estrela and so forth. And for long time, municipality has planned to move people from those barracks, shabby stalls and so forth, and put them on another place. Could it be like a formal market or what? And it never managed for years. They have been there for decades. And now, I don't know if the images I received through WhatsApp are true or not, but Mercado de Estrela almost disappeared. And I received photos, you know, of as if they were bulldozed, you know, and also shown the place where the people went to. But I need to check, really. I'm not sure. Now, what I am sure is the way police is enforcing, you know, the state of emergency, particularly the issue of social distancing and the use of masks. You know, I think there is a problem because police in Mozambique, to my view, is they are part, you know, of some kind of a authoritative environment, political environment, I think so. And I wrote about that, and you know, so I can say it loudly here. Police is a repressive factor, you know, and what I was questioning, and I was speaking with people that are part of this advice board to government, and I was saying, why not use the police to inform, to educate population, you know, and also as with dissuasive practices, not, you know, the imprisonment of people, but it depends because, you know, the police what? Okay, police act in different ways according to the different environments. So in what is the middle class, high class neighborhoods, you know, if you don't respect or the law, you can be imprisoned. But in the shanty towns, what they are actually doing is beating up the persons. For instance, if people stay, well, they even show it on TV. I mean, after 5 p.m. in the streets. And in terms of, for instance, one of the reasons that people, street vendors, you know, something that the government didn't think about, was they were saying, look, this is the time on which we manage to sell, because we get the persons that are getting back from their work and they are buying whatever they can buy, food, mainly produce, you know, in order to go home and eat. So if you prevent us to sell from 5 p.m. on, this is actually because we don't sell at any other time, you know, or we sell much less. But yes, police force, an authoritarian regime, and the instrumentalization of COVID-19 for other purposes, you know, beyond the issue of COVID-19. Okay, and thank you for your questions, Roberto.
Hi, Carla.
Thank you, Carla. Francesca, okay, let's go.
Hi, Carla. It's really nice to see you again, and thank you for your presentation. Actually, I have just one really rapid question that is around the situation in Cabo Delgado. I would like to ask you your opinion about what is happening in this province, in this part of Mozambique. News that arrive here in Portugal are dramatic. It's not just for the COVID epidemic, but in particular for the situation. They are speaking about state of war. And I heard about that there are a lot of, well, one NGO, Doctors Without Borders, that have to leave the province. I don't know if it's true or not. And that they actually want to close the province. So, I mean, what do they mean? And how do they think to do that? And what do you think about the situation of what will happen in the next period? Thank you.
Okay. Thank you, Francesca. Actually, I will be very cautious because I don't fully understand what is going on Cabo Delgado. And I'm a bit skeptic as what is the dynamics around the conflict. Anyway, there are several factors as far as I know. One is this jihadist insurgency, which some people were doubting, but it was then clear when this hopefully is not fake news. I don't think so. Like they were taking different villages and taking photos, with their flag and so forth. So I would say it's almost established, that there is jihadist insurgency in Cabo Delgado. But on the other side, also, and this I'm relying on the work of, of Yusuf Adama, that our forces, meaning government forces also, and it gets into what Roberto was asking about the role of police and the military. It's so authoritarian, so brutal, that it's so brutal that actually, they also damage the relationship. And so it's as if the population is defenseless, either by jihadist insurgency or even, the armed forces, Mozambican armed forces. I have seen, or not I have seen, but I have researched this kind of situation like years ago, in relation to this civil war, in which the population was saying exactly that. We feared everybody, we didn't have anybody to we feared, as long as there were soldiers, we feared. Would they be, from government? This is a very tough issue to deal with. And the other point is we cannot forget that, the timing of this jihadist insurgency, and, and why in Cabo Delgado and not, I don't know, in Nampula, for instance, or other province. And I cannot help but make the connection of the discovery, of gas and petrol, and also by the districts they are working on. So they begin working on the district of Mocimbo da Praia, and Mocimbo da Praia is the district where the LNG platform is going to be, and there is all kinds of infrastructures being built and so forth. So is it a coincidence? On one hand, but it's also the place where people were displaced, were taken out of their land, and we can question how they were compensated for it. So it's a very complex and difficult and explosive situation, I would say.
Thank you, Carla. Is there anybody else who would like to ask something to Carla?
Well, if I can, I may ask something.
Of course.
I would like, just at the beginning of your wonderful speech, Carla, you mentioned the fact that COVID pandemic is not certainly the only big health problem that you have in Mozambique. No, you mentioned HIV, you mentioned malaria, and you mentioned the structural difficulties you have with water, with all the goods that you need in order to protect yourself from this kind of pandemic. So I was wondering, the problem is that I suppose that for all of us anthropologists, it's rather difficult to understand what's going on in the field because we are not allowed to do field work. But maybe with our networks of friends and colleagues, with sometimes a good press that gives voice to people at the margin, we may acquire some information of how people get along with their situations, and as you have shown to us, with great creativity, invent their own ways to cope with the difficulties they have to face daily. So I was wondering how much the urgency that we feel in the wealthy countries like Europe is shared by people who probably have every day to cope with much bigger problems. The magnitude of the pandemic is probably not at all the same that you feel in other parts of the world, where you have other issues to cope with daily. I don't know if I've been clear with my question.
Yes, you have. And thank you for your question. Okay, and thanks also for the tip, I would call it tip, to use networks, to acquire information, because we really have to be creative and see. Okay. Now, about first, the pandemic, has been unfolding in a very particular way in Africa and in Mozambique. So the first confirmed cases was on March 23, and up to now we have only 430 cases, only 2 deaths. And also the cases are mild, and so people are not hospitalized. So this is one. And the other thing of this, the issue of danger, the sense of insecurity, of danger and of urgency, I will relate to what people told me when I was researching on HIV/AIDS. And I was researching on a province which was like the stage for the civil war, which was a main stage for the civil war. And people were saying, HIV/AIDS was just another problem, and they were not really worried about death. And they would say, for instance, something like, okay, how could I translate it into English? It would be something like, death is death. It doesn't matter what you die from. You can die from being caught, in crossfire, or of anger, yeah, vomit, or though I have never seen anybody dying of hunger. But, so it was just another level, another layer of danger, even in relation to death. And actually, I could see that the conception of death, was very much influenced, by collective memory, and body memory also. People remembering things, 20 years ago, like smells and noises, of course, but I remember the issue of smell, what they smell, yeah? The smell of food, the smell of burning houses, and so forth. And all this was very much present, and actually AIDS did not arose or arise the fear that could eventually on another context. So maybe there is something like this for COVID-19, and even less, because COVID-19 is even less cases and less than it was HIV/AIDS. But it was something to think about, very interesting.
We wait just a little bit.
Yes. You know, I'm trying. Okay, I could see that Simona was trying to make, yes, you did, cultural translation.
Ah, Seminole City, I tried to
That's so true,
translate.
yes. What is the seventh city? Yes.
I don't know if it's right. I didn't know the words to say caneto in English, and I quickly checked on the dictionary.
No, but that's great.
Okay.
That's great.
Carla said before that if she had time, maybe she would like to share with us the story of the yellow tank. I don't know if she wants now to share this story of the yellow tank. But I think that what you said concerning the death, the atmosphere of death, it's so important because we have to wonder what's happened in a country when, from an epidemiology point of view, the number of people at risk in time of peace is quite the same of the epidemiology of the risk in wartime. So what's happened in a country when in the time of peace the possibility to die in a very arbitrary way and without any kind of sense is the same of die in a war condition. And this is not just an issue concerning Africa, of course. We have this kind of discussion too in Italy when we face with the plenty of car and bus full of dead people coming out from Bergamo. And so the metaphors of war in time of peace re-emerge as a kind of social memory in the population and even in young people. I mean, in a population in which there are no this kind of direct memory, but this means that the social and collective memory works and pass through generation. But if you want just to share with us the story of the yellow tanks, we thank you.
Look, this they are locally called gallon, which is from English because they have 20 liters. Like it's a gallon or something. I guess it's that it corresponds, a gallon corresponds to something like 20 liters. I think I'm right. But if you look at it, they are all yellow, you know. So it's not like some container, you know, just some container. So they begin to come with humanitarian aid during the war. I'm not saying they are the same, but so they came with, this is where oil and butter, because it was, you know, oil, sugar, and butter, you know, just for this extremely malnourished people. And they came in these big yellow gallons, you know, from different parts, you know, from the World Food Program. And till today, retailers, you know, receive oil on those big quantities, and then they sell it in parts. So actually, those yellow containers are all from, because they are quite resistant, huh? You know, and people even use it as to sit on. It's not a fragile thing, but so this is what I wanted to tell you from those times, so many years ago.
Thank you, Carla. Is there anybody else who would like to make a question, or if not, maybe it's time also to
Yes, I think so.
take a rest, as you prefer. I don't read any chat, and so I think maybe it's time to close.
Yes.
Well, maybe we just would like to know something else about how is the situation evolving? Because you told us that there are very few cases at present, and probably not all of them are reported because, as you already said, very few people go to in hospitals, and probably not all of the cases are being detected and reported. But although probably there is not a good, how to say, good checking of the epidemics, in any case, COVID-19 is not the highest emergency in Mozambique. You have many other issues. So this is rather, how to say, hopeful for us. No, we have come from a difficult situation in Italy, and we were very much scared that in other parts of the world with not so good health system as in Northern Europe, things would be very critical. Just think about the United States, where an enormous amount of population is not covered by the healthcare. So we were very much scared that in poorest parts of the world, things would become very, very critical. And instead, some parts of the world, although they are quite poor, they probably are not living a very high degree of risk like we have been living in Europe and like our friends in the United States are living, no? Or in other parts of the world. Just imagine Brazil, where the situation is worse and worse every day. So I was wondering, how do you explain this lower effect of the pandemic in certain parts of Africa? No? What are the factors that may contribute to this lower incidence of the pandemic that gives us hope for the future and makes us have a sense of relief for our fears? Thank you.
Thank you, Alessandro. First, speaking of Mozambique, it's true, it's still very small cases and so forth, but I try to be cautious because, these average figures don't translate what might be happening in the ground. For instance, Nampula, northern province, it's the one that already reached communitarian transmission, which none of the other 13 provinces had gone through communitarian transmission. So let's see. Now, this is just an hypothesis, of course. As I was seeing the countries that were first affected by COVID-19 and thinking of Africa, which came much later, I thought this is somehow a measure of the gap, between, I don't want to speak about first countries or first world or something, but okay, North America and Europe, and Africa, how these chains, these global chains of trade, travel, and so forth are much less. you know, in Africa, maybe. Because what I think also is that somehow this virus traveled through this global, you know, network. For instance, in Mozambique, the very first cases, it was a very, anyway, someone that came from Britain and the other one came from whatever. And then, sorry, and then the cases were in Cabo Delgado, you know, which was the first kind of epicenter, which is where, you know, oil and gas is, and then there is, you know, people from different nationalities traveling, going, you know, they even have their own kind of planes and so forth. So this is one. But what has been hypothesized is, one, in case of Africa, that the age structure of the continent, you know, which is so different from Europe in terms of, you know, the preponderance of youth. So not old people. This is one. The other thing, and this is the one that is being investigated and probably could be some kind of answer, is the TB vaccine, tuberculosis vaccine. Tuberculosis vaccine, at least in Mozambique, is universal. You know, and there are these mass campaigns of vaccination of TB. And there are several preliminary clinical studies saying that the TB vaccine actually prevents or protects not only against, you know, the bacillus for TB, but for another kind of, I don't know the biological terms. And this was one of the reasons, for instance, of the comparison between the cases of Spain and Portugal. And it seems Portugal has a mandatory TB vaccine and Spain doesn't. Now, there are some studies, and one of them is being done in Mozambique concerning this, the TB vaccine, you know, and see if it actually played a role or not, you know, to why people got such mild cases. Now, you know, this is just from the information I have. USA, you know, when people say, oh, a country like United States with such advanced medicine and so forth, and such advanced health system. And I am sorry, in my opinion, they don't have health system. I mean, they don't, not in terms of system, you know, there is no such thing. So it really doesn't surprise me. If you don't have insurance and you cannot go to a private whatever service, you know, then you got this high prevalence and number of deaths and so forth. So USA it's not a surprise to me, and I think it's the worst example ever. But as for Brazil, I think besides all other problems, there is a leadership problem, very big. I mean, you know, so it just happened. Well, it's also a leadership problem in USA. You know, and in these cases, countries with more responsible, clear leadership, you know, have done better. And I have to say, in the case of Mozambique, something I am always complaining about the status quo, but something that kind of surprised me from a positive point of view, which is We had the first case on March 23, first confirmed case, because this issue of tests is very, anyway. So on the 1st of April, we had state of emergency. There were no deaths. There was one case. You know, so I think exactly because somehow we were fearing, you know, thinking of Italy, which up to now I can't actually even speak about it. Spain also. So these, when seeing all those images, you know, we thought, maybe the government thought, okay, our only chance is prevention. And so 1 week after the first case, you know, the state of emergency, quarantine, and so forth was declared.
Thank you, Carla. I suggest if you can, all of you, to open for just a few minutes your video. We can greet Carla and all of us sharing for a few minutes our face is better than just talk to a screen. So if you can open your video for a moment, it would be great. I remember to, hi everybody.
Why not microphone too? Hi, Carla.
Okay. Hi,
We make a lot of echo.
Roberto, Alessandro, all of you, Francesca, Cristina, Massimiliano.
I just remember to all of you that on Friday, this Friday, the 12th of June, we will have another meeting with Roberto Campos, and the link is on the chat. So you will have the WebEx link there, but Alessandro will send to us the dépliant, locandina, non so come si dica, sorry. Thank you, Carla. I think that your expression of Mozambique as a country of excess can give us a very clear image of this tension between structural discrimination and structural problems, but also the structural resistance of population through creativity and any form of hope for life. I mean, is a kind of desire to really stay alive. So thank you so much for this image. We hope to keep in touch with all of you and hope to see you soon next Friday.
Okay,
Thank you, Simona. Thank you, Carla. Thank you, everybody.
Ciao.
Great pleasure.
Thank you all.
Thank you. Ciao. Ciao.
Obrigada, Carla.
Ciao, it was
Ciao,
a real
ciao.
pleasure.
Un abbraccio grande, un grande piacere.
Ciao.
Thank you, Carla. It was a pleasure.
Ciao.
Thank you.
Thank you. Ciao. Ciao. Ciao.
Bye bye. Ciao.